These are in listen-only mode.
Hello, everyone. Good afternoon or good morning, depending on where you are today. And we are so grateful for all of you that are joining us here at Easy Claim and Bill Flash for our Eliminating the Barriers to Patient Payment webinars and helping you to learn about a great tool and many great tools that Bill Flash has for helping your practices and or billing services get paid for those patient payments. So I wanted to just let you know that Bill Flash is offering some really great deals and some amazing giveaways. So we're so happy to have you with us today. And with that, I'm gonna hand it off to Richard Davis from Bill Flash, who's gonna be presenting for you. Now, we are also recording this webinar. So if you have colleagues that wanna watch it again or listen to it again, you certainly will be receiving that as well. So Richard, I'm going to hand it off to you and we'll get you started here.
Great. Hey, thank you, Susan. And I just want to take a second and express our gratitude for our partnership with EasyClaim and for their cooperation in creating this webinar. I also just want to take a minute and recognize and express our most sincere and heartfelt concern for what's happening in our societies today. We know a lot of you guys are on the front lines working with patients and struggling to get through these challenging and uncertain times. And we want to be a good partner for you and provide a good service and help you guys. And we think that there's some value in what we're going to share today. So thank you for spending time with us. And I really do hope that everyone is safe and well and doing okay. So thanks again for spending time with us. I know these are hard times. What we're going to be talking about today is we're going to share with you some statistics on the shift that's happening on more focus to patient self-pay, what patients owe you, aside from what insurance companies reimburse you with for the services that you render your care. And we'll share some statistics and factors that are going into that. We'll talk about ways we can eliminate the barriers for your practice to get paid from your patients and increase your payment acceptance success. And then some tools that we can offer as a joint partners, EasyClaim and Bill Flash, to help you guys meet these challenges. So I want to start off today by introducing a poll question to you. And I'm going to, if you watch your screen, I'm going to launch a poll here. And there you go. What percent of the healthcare dollar in the US do you think will be patient responsibility within the next 1 to 2 years? All right. It's looking good. We've got about 40% of you that have engaged on this. Appreciate you guys interacting with us here. I'm going to give it about 10 more seconds and close the poll. All right, I'm closing the poll. Let me share with you what we have here. So about you guys were really close. Good job, thank you. And I'm curious to know why you voted what you did, and we'll go there in just a second. So let me go back. Let me go back to our presentation here. Okay. Okay, great, you guys. Thank you. So back in, let me just share this with you.
Yep, there we go. I was going to say, we're not seeing it.
Okay. Back in 2013, then CEO for Aetna, Mark Bertolini, he was addressing a some attendees at the HIMSS conference, and he made this statement. He said, patient responsibility will climb to be more than 50% of the healthcare dollar by the end of this decade. And we are actually at, from statistics we're seeing today, we are at the 50% mark now. So I think a lot of you are right. Within the next 1 to 2 years, it's going to be even more. And I want to share with you why we are seeing that shift. But I've got one more question I want to ask you, just as it relates to your practice specifically. So here goes one more poll. What percent, or let's see, is collecting patient payments for your practice becoming easier, the same, more difficult, or you guys don't even try because it's just a mess and it's just difficult? All right, I'm going to give it just a few more seconds here. That was great collaboration on that one. Thank you. And let's close that and share that. You guys can see. I'm curious to know for you who voted the same, whether or not the same means it's easier, if it's always been hard, if it's always been easier, what that means. So I'd be interested to get some of that feedback from you. So anyway, thank you for cooperation. So let's just get into it. I'll hide this here and go back to screen monitor 2. All right. So here's what's happening. So the amount a consumer must pay before any health plan pays any portion of their healthcare bill has increased by 255% since 2006. Today's American healthcare consumer is paying almost 35% of medical expenses out of their own pocket, and that's triple the amount paid since the 1980s. The number of insured Americans pursued by healthcare debt collectors is now 1 out of 5 from patients with high deductible plans. So providers on average are collecting right now about 18 cents to 34 cents on the dollar of what they're owed from the care that you're rendering. This is a struggle, and especially when we're in times that we're in right now, you guys have got to have more easier ways to collect from patients. And I'm going to share with you how to do that. What's causing the shift? Number one, it starts with high deductible health plans. High deductible health plans are requiring patients to meet higher minimums now, which means providers can't plan on getting any kind of reimbursement from your insurance companies until those deductibles have been met. The next thing that's happening is that value-based care, although a wonderful thing, maybe you don't agree with that, but value-based care is causing an increase in administrative costs, which practices are having to collect and submit more quantitative data on the patient experience in order to receive reimbursements. So reimbursements are going down, causing practices to have to try and collect more from patients. You guys don't have the time to do that. You got to focus on caring for the patient, right? That's what we're trained to do. Here's a couple of more influencers I want to share with you. We now have new consumer preferred communication and payment methods that have been launched since, this new generation of patients. They prefer to be communicated with and to have specific methods of the way they want to receive and pay their bills. Also, you've got consumer review platforms. The consumer experience is more how patients review and recommend everything about their experience, from check-in and registration, engagement with administrative staff, nurses, and providers, to their post-care communication, whether it's education they receive about post-care therapy, medications, or whatever that may be, and especially how they pay their bills. So giving reviews is one of the biggest drivers on how consumers, or in this case patients, make decisions today. And those decisions they're making, their reviews, are being blasted on the internet for public to see. So the reason this is an influencer is because since they're having to pay more and they're being billed more, They expect more. They expect better customer service. They expect better engagement, better communication, better methods. And it has to be their way. That's just the generation we live in. All right, let's do another poll. I love these. Let's do this one right here. Here we go. What % of your total practice revenue comes from patient responsibility? Wow, this actually surprises me a lot. And I think I need to update our polls a little bit. I'm going to share this now. This actually is concerning me a little bit. Let me share with you until we'll talk about why. Most of you are only seeing 21 to 40% of practice revenue, and I don't know if that's because if that lower amount is if these lower percentages are because maybe you are getting reimbursements from insurance companies. I'd be interested to know. Maybe you are just struggling to get paid from patient payments, and that's why you're in this webinar today. So thank you for your participation. Let me close that and let's just get into it. Let's just get into how we can overcome these barriers and help increase this revenue for your practice. Okay. Here we go. All right. Starts with the number one thing you need to do is improve your communication with patients. This is critical. Improving the patient billing experience by communicating and managing billing expectations. Patients need to know what their options are going to be in receiving communications. So when they come in and check in, maybe even before they arrive to your front desk, they want to know what to expect in terms of how they're going to be billed for the care they're about to receive. Am I going to receive a text message? Am I going to get an email from you guys? Is it going to be a phone call? Do I need to log into a portal? Do I need to look in my mailbox for a statement? We sadly just can't assume anymore that we can just do whatever we want when it comes to communicating with our patients and customers. And these statistics show you what I mean by that. 70% of patients are confused by their bills today. A lot of times they get a bill that says this is not a bill, or they don't know how the bill's coming in and what to look for. 93% are surprised when they get a medical bill. That's so funny. And then 50% receive bills they did not expect at all. And so this is why communication is so important. You're not going to get paid if the patient doesn't know how to expect to receive communication from you. Number two, as it relates to communications, communications need to be the way they want it to be. Today, 71% of patients prefer receiving their statements electronically, and more than 80% prefer to pay those bills online. Okay? So if you, when you engage your patients and you say, hey, so the way we send bills today, we're going to send you one in the mail, and we're also going to send you a text message or email. So just you know what to expect. So be watching for that, as long as they know that up front. But just know the way they want it is electronically. That's just the generation we live in. So if you're not offering that as an option today to communicate with patients, it's something that that you should definitely look into if you really want to increase your success in getting paid. Number three, expand your communication methods to cover all of your bases. So it starts with in office, and you could even argue that it starts prior to them arriving in the office. If you have an engagement platform that allows you to send a text message or make a phone call to the patient prior to arriving in the office, that's a great method as well. And there are solutions like that out there. But it does start at least once they arrive with you providing them what to expect. I know an office that I go to, they do a very good job when I check in. They give me a brochure every time to make it clear how should expect to be billed and what my payments are going to be. The patient statements are huge. So I know that we're talking about how patients now prefer electronic communication methods, but you can't back away from printed statements, and I'll tell you why. Printed statements are guaranteed communication methods. They have to physically handle that envelope and statement, even if they're going to throw it away. They're at least going to be picking it up and looking at it. And if they recognize the name in the envelope window, they're probably going to open it. And when they open it, if you take advantage of inserts or onserts and backers that are now available for you to add messaging or advertisements of any kind, then you have a guaranteed method of communication. Again, even if they're going to throw that away. You've got your patient portals, your website, email, texting, IVR, etc. So number one way to overcome barrier to getting paid is improve your communication with your patients. Make sure they know how to expect it and provide it in a way that they prefer it. Okay. All right, number two, communicate payments up front. This is one I think we can agree most practices do. It would be silly to think that any practice is not taking a form of copays at the time of visit. Some practices have even implemented copays prior to the visit through pre-visit messaging methods. But what's not happening in a lot of cases is that it's not happening with an integrated patient billing and payment technology like what EasyClaim and BillFlash can provide. And the way that's important is because you can avoid awkward questions that we're not really trained to ask and talk about. We're trained to provide care. We're not trained to talk about how to make payments, right? We're just not. And so if you have integrated billing and payment methodologies into your platform, your system, then you have the ability to avoid these awkward questions and conversations with your patients. Let me tell you how. In-office payments with an integrated solution like what we provide you guys create an opportunity for you to get a payment method stored on file, and then you can use that on-file payment, which is done securely, I want to add, to set up automatic payment arrangements and recurring payment plans. So instead of the patient coming in at the time of care and you saying, how are you going to be paying your bill today? You can just ask them the question or just say, will you be paying with the card on file ending in 4321? All right, you've already got the payment method stored on file. And so the patient knows that because you communicated that up front and you've already collected a portion up front, and now you're set up for more successful ongoing and recurring payment methods. All right, this is almost guaranteed to increase your payments by 60%. We've tested this. And the reason why it's successful is because almost all patients say they want more transparent methods of paying at the time of care. And so the more transparent you are and the more integrated the payment is, the easier it's going to be for you to be successful at this. All right, we're going to talk a little bit more about automatic payment plans here in a minute. Let's move on to a poll question. How many payment methods do you think the average U.S. customer prefers to use? All right, so we're talking a lot about patient preferences. Let's see what you guys think you might know about your customers here, your patients. And then I will close the poll and provide you some data behind this. Give it about 10 more seconds here. And okay, let me share you with this. This is interesting to me. That was a very fast poll, by the way, so thank you for your participation. Most of you think that U.S. customers prefer at least 2 methods of payment. Some of you think just 1 method of payment. So let me share with you what the data tells us. I'll close this. 70% of US customers use at least 3 different methods to pay their bills every month. We're wondering what type of payment methods are there really that we can offer to provide this to our patients. Let me share that with you. We're going to get into the details here. Expanding your payment options is going to likely increase your chance of getting paid. 80% say that their loyalty to a practice, this is a really important stat. I wish I might have it on here, but listen to this. 80% say their loyalty to a practice is not based on the level of care they receive. It's hinged on convenience factors. That includes the way they receive their bills, communication, and payments. Listen to this. 61% patients say that they would consider switching practices if a separate clinic promised convenient bill payments. I'm not making this stuff up. I will provide this for you in detail. Here are some options you have from a billing standpoint. You've got the ability, like we said a couple of slides back, to send bills via print and mail. And print and mail includes, of course, the ability to add messages on the statement itself or inserts, onserts, and backers in the envelope to make sure your message is clear. You've also got, of course, the ability to send electronic bills. And electronic bills in itself is email and text now. So there's 3 options right there on ways you can send your bills. Now let's talk about payments. Here's payment options. Let's start with in-office. In-office alone, there are multiple payment methods. I'll share them with you. So they come in, they have a copay, and your terminal alone presents at least 3, 4, maybe even 5 payment methods your patient can use. So you've got the ability to swipe a credit card or debit card. Terminals now have the EMV chip and PIN, so insert, that's another method. You've got Apple Pay, Android Pay, Samsung Pay, and Google Pay, where they can either tap their card on your terminal or use their phone and tap it against the terminal. There are 4, 5, 6 payment methods alone with your in-office terminal if you've got the right terminal. And again, the key is communicating to the patient what their payment method options are. If they know coming in that you provide the way they prefer to pay, you're likely to get paid. Now you've got online payments, and there's multiple online payment methods. There's the ability to put a Pay Now button on an electronic bill, whether it's a text or email. And we'll show you a little bit about that here on Bill Flash in a minute. But you've got online payments, and 90% of patients today prefer to pay their bills online. So you've got to at least offer online payment. Stored card payment methods. We talked about that last slide, where we run a payment and we store a token in your software, EasyClaim software, and that token represents a card or checking account, which is another payment method, by the way, still. And you can use that stored card payment to create monthly plans and automated plans. So just even in these 5 options we've outlined below, those turn into 20 plus payment methods that you may have not been aware of. And if any of you would like me to more detail outline those for you that we've discussed here today, just let Susan know, and we'll provide that for you in an email or in a demonstration of our system. Okay. And number 4, you have to automate patient billing and payments, and I'll tell you why. Higher billing volumes today, higher deductibles, because of the shift to more patient self-pay responsibility, you have to automate payments. You have to break out the amount that they owe you into smaller payment amounts and in segments. Additionally, automating the payment in those smaller segments is especially important during uncertain times like what we're living in right now. So again, if you use the stored payment methods where we use a token and store their checking account or credit card number on file, again, securely, you can break up what they owe you into smaller segments over time, and you'll break down that barrier and receive more payments. These are the four main methods. We'll summarize them here in a minute. But what I want you to know is we've tested these over the last several years here at BillFlash. We've tested these, and we have found that practices that implement these methods that we've shared with you today have seen an increase of 60% of what they're owed within 30 days. So the payment amount they're receiving is likely higher than 60%, but they're seeing 60% of what they're owed within 60 days by using all these methods and barriers that we've talked about today. Let me just show you a couple more things here. Susan, why don't you take over for a second and just show them how it kind of starts in EasyClaim, so it's a more simple process for them administratively.
Yeah, that's great. Thank you, Richard. So those of you that already have the EasyClaim Premier program, you'll see in the flow tabs and the main screen, and that's what we're looking at, where you have that patient statement tab. And of course, you can get to it from the ribbon bar as well. But when you click open that patient statement button, it allows for you to be able to call up your patients that have balances for whatever minimum balance and be able to set the statement format to BillFlash. So in the drop down, if your patients have decided they want to receive statements by mail or by e-pay, e-bills, whatever they've decided to enroll for and you've enrolled for with BillFlash, we can now see everything right in the program. So it's fully integrated once we get you enrolled and get you activated in the system. Of course, all of this is very simple to do. It's a couple clicks and your patients are either mailed their statement or you can choose to have it sent as an e-bill. So these two screens kind of just demonstrate that in the program. And of course, our support team helps you with getting that set up and established if you decide to enroll, and make it easy to start having those patients receive their bills. Eliminates you guys having to print those out and stuff them yourselves, and utilizing all those options that Richard mentioned to make it easy for those patients to have some choices of how to pay on those balances. So a couple of other screens that we're showing here are also just on the ribbon bar under Tools. Once you are activated and turned on with that integration with BillFlash, you'll see the icon up there in the ribbon bar next to Program Setup. And what this does is it allows me to be able to see those payments that the patient paid online through their e-bill with the BillFlash setup account. And so I can port those back in and be able to disperse it to the correct service line for that outstanding patient balance. And then below that, we have the Office Pay, which is another great integrated tool that you enroll for the credit card or check that you might want to accept another payment method from your patients, to be able to send that automatically either using a card swiper or typing in the number right here on the screen in the software for that integration and collection of that payment. So we make it really simple. It's a really great tool, enhances your practice, and helps generate that extra revenue and ways for your patients to pay their bills and be accountable for that service.
It's all integrated to better your experience. So this has been done to help you guys, the administrators in the practice, But the 4 barriers we talked about today is more of a focus on improving the experience for the patients, right? Let me tell you guys a little bit about my background before we wrap this up and provide you with a potential incentive to see some things. But my background is in the credit card processing industry. I've been in it for over 21 years now. I started 21 years ago with a company called Authorize.net, who was the first payment system to accept credit cards on the internet. And over time in my career, I moved into integrating payment processing solutions with healthcare applications like EasyClaim. But until I joined BillFlash, I was missing what was really important for practices about getting paid. And that was more about what patients want, not just what you want as practices. I don't take offense to this. This integration has been done to simplify your administrative workflow and costs, but we think about really what it takes to get paid from the patient. What they want is they want access to the bill. So if you have a credit card or payment processing solution today that you're using, and you send a balance notification to the patient, maybe you're using text, maybe you're using email to do that. But what you might be missing is that the patient wants to know why their balance is what it is. So when you can tie it to a bill or statement, like what we can provide in one solution here for you, you're more likely to get paid because that's what patients want. That's what I've learned in 21 years, actually more like 12 years, specifically the healthcare space of integrated payment processing. So for you, we reduce the number of vendors you have to go out and get to provide a easy to use solution for your practice. You have to go get a software. You have to go get a contract with a merchant account or a gateway or whatever. It's all been integrated and simplified into one solution for you guys to use today. All right. Let's wrap up with a couple of things here for you out of respect for your time. 73% of providers report that it takes longer than 1 month to collect from patients. Be interested to know if you agree with that. If that's the case, I can prove to you that the 4 barriers we talked to today about what patients want and prefer, added to the integrated solution EasyClaim provides you, you are likely to see an increase of 60% of patient payments within the first 30 days. Okay? Now, maybe that's not going to be entirely true during this time we're in with CV19, but I still want to show you something. We created a cost calculator, an ROI, based on all of this data and these methods that we shared. If your practice sends on average 250 statements a month, and your average patient statement amount is $100, we've estimated that your average cost to send a statement yourself is about $3. Okay? So your total cost based on this data to send statements is $750 a month, with a total patient billing amount of $25,000. But you're only likely to get paid roughly what we've seen with non-integrated and BillFlash services is you're only likely to get paid about $6,200 of that $25,000 for a total practice revenue of $5,500. But if you implement the EasyClaim BillFlash solutions together, your cost will go down to $193. That's from $750. Your average cost to send statements will be $13 for a monthly revenue of $10,000. Your revenue after billing costs using BillFlash and EasyClaim together goes up to $9,700. Again, that's based on 250 statements a month at $100 per statement at a cost of about $3. And that's you collecting 25%. If you're interested to see a more accurate ROI on your practice, let me know through Susan, and I'll send you a link to this calculator where you can plug in this data yourself and move this slide bar to what your more accurate pay rate is. But based on the poll we had, you can see I've got this at 25%, whereas 60% of you said that you're at the 20 to 40% range. So we're almost right there in the middle of what this is. So this is almost very accurate. So if you implement these methods we talked about today with our integrated solution, you see an increase of $4,200 a month to your practice immediately. So in summary, improve communication with patients, communicate and collect upfront, provide multiple billing and payment options, and automate your billing and payment methods through our integrated solution. And if any of you are interested to see exactly how it works, we are offering a $25 Amazon gift card to the first 10 of you who email us or call us to see a demo of EasyClaim and BillFlash. $25 on Amazon. And we'd love to give that to you. Now, there's only roughly 20 or so of you, maybe even less, on this webinar. So whoever wants $25 on Amazon, I'll leave this up for a few minutes and let you email or call in. In the meantime, Susan, are you seeing any questions that we need to answer?
I am not on my end. I think it's coming up on your end because of you being the webinar organizer.
Okay.
But nope, I'm not seeing any.
And no questions over here either, Chard.
Oh, hey, James.
Richard.
Hey.
Yep,
Great.
James
Hi.
is on.
Great, excellent. Good to hear your voice, James. So yeah, if would love to show you guys this demo and getting you guys paid. Again, I want to wish you guys the very best and our most sincere and heartfelt concern for your well-being, you and your families and your staff. But let us be your good partner in this and help you guys get paid through these challenging times. So we hope to hear from you guys soon. Susan, I don't have anything else if you do.
Well, I do have one other thing, is to say thank you for sharing this great webinar with us and our clients. And we want to thank you also for sharing your special day. It is Richard's birthday, everyone. So happy birthday.
Yeah, it is. It is.
Yeah, thank you for spending it with us and our clients, a little bit of your time.
It's absolutely
We
my
appreciate
pleasure. Thank you for that shout.
Yeah.
I appreciate it.
Of course.
All right, you guys, be safe and well out there. We hope to hear from you soon and take care.
Absolutely. Call Richard or call EasyClaim. We'll be happy to get you with that information, and anybody can schedule a demo with me if they want some more consult on it. Thank you everyone for joining us, and we appreciate your time.
Yep, thank you guys. Take care.
Thanks again.